Really excited to get stuck into your new book. So can I ask you first of all just to introduce the title of your book and I don't know, a short synopsis of what the book's about?
Sure. The title is called The Breathing Cure. Now, I didn't come up with the title of it because we're always afraid to use the word cure. Um, just in case people kind of think that we're saying that breathing is a magic bullet. But I went with the title. It was chosen by our US publisher. I actually think it's fairly pertinent because I suppose, Mike, we have to consider the application and the potential of breathing exercises. And when I look at breathing and the depth of breathing, it's not just about, what you hear people often say, go and take a deep breath. It's nothing like that. It's changing breathing patterns. And by influencing breathing from functional breathing from three different dimensions, the biochemical, the biomechanical, and resonance frequency breathing, we can influence pretty much all of the major disciplines of medicine. So for people with respiratory complaints, we can improve control of breathing. We can reduce symptoms of breathlessness, wheezing, coughing. For people with mental health issues, we can make significant differences for people with anxiety, panic disorder, PTSD, and depression. People with sleep issues, we can influence insomnia, snoring, and obstructive sleep apnea. And I've just had a scientific article that I wrote in conjunction with an ear, nose, and throat doctor, Carlos O'Connor, and Dr. Plaza, and we had it published. It was peer-reviewed and published just 2 days ago in the Journal of Clinical Medicine. So it's a high-impact journal. And if we were to look then at functional movement and the relationship between functional breathing and functional movement, diabetes is influenced by how we breathe, and by changing breathing patterns, we can improve diabetic control. Epilepsy, for 100 years, it has been shown that hyperventilation can contribute to some forms of epilepsy. And, even if we were looking at dentistry, craniofacial development of the jaws, whether children are going to develop crooked teeth or not, because that's going to be influenced by mouth breathing or not. So, breathing has been overlooked. It's really, really, it's really, to be honest, which I don't know whether it's frustrating or if it's bewilderment. And when I think of the industries and I think of the very intelligent people in medicine and dentistry, how did they miss this one? I really wonder it. And this is not new information. And the Breathing Cure is putting it out there. It's a big book. It's 500 and something pages. And it's 190,000 words. There's about 40 pages of references, but I've made it accessible to, or at least I've tried to, in that the first two chapters contain all of the exercises. The rest of the chapters then are looking at specific issues. Women's breathing, totally different to men's. Known since 1905, and yet how many females know about the impact of breathing? How many females know about the impact of changing hormone levels and how that's going to influence breathing, and how that in turn then contributes to pain, fatigue, anxiety, symptoms of PMS, and then postmenopausal women, how breathing can influence sleep disorder breathing. So, I think I would say that 2020 was the year of the breath. It's a breathing revolution that's going on now. I've waited 20 years for this to happen. And it was a long slog. And breathing does have a little bit of a bad rap because people have been talking and teaching breathing exercises and not necessarily knowing the physiology of what was happening behind it. And I remember, taking this advice back in 1995 or 6. I was doing final exams in Trinity College in Dublin. So I suppose it was 1996. I was anxious going into the exam, one particular exam, and I went for a walk for 2 minutes, and I went and I started taking these full big breaths because I believed at that time that it was beneficial to take these full big breaths. And I went into the exam hall. I was spaced out. I was lightheaded. I never realized that the more air I was breathing, it was reducing blood flow and oxygen delivery to the brain. It was entirely the wrong thing to do. Now, how many times have we heard in the Western world, take big breaths, breathe harder, breathe more air because it brings more oxygen throughout the body? We have to question that. And it's not just about the biochemistry. And I think so also, Mike, the point that I'd like to make is that breathing, when people train in breathing, they train according to traditions. They typically have their guru, and their guru is saying, this is the way it is. I had my guru, Konstantin Buteiko. I followed his method, which is a wonderful method, focused primarily on the biochemistry. Wonderful method. Not taking into consideration enough about the biomechanics, not looking at all about the resonance frequency breathing. The yoga instructor is focusing on the biomechanics and often sacrificing the biochemistry and not looking at resonance frequency breathing. The heart mat instructor, who's looking to improve heart rate variability, is focusing on cadence breathing or paced breathing, not looking at the biomechanics and not looking at the biochemistry. And who is looking at nasal breathing? Because it's only with nasal breathing that we can influence all three dimensions. And all three dimensions, even though studies will show that, they may not be as interconnected as strongly, we still have to look at the connection here. If you've got good biochemistry, you typically will breathe low. So you will have good biomechanics. And if you've got good biomechanics and you breathe low, you in turn will breathe slow. And slow breathing then is influencing your biochemistry. And, that's the depth that I wanted to look at with the breath. And the other point that I like to make is that it's not just about how we breathe inside the studio. The breathing instructor who is teaching breathing exercises to their group of students in the studio, why not show the students how to breathe outside the studio? Why not show them how to bring these good breathing patterns to help with their sleep, to improve their resilience, to help deal better with stress, to significantly reduce asthma? Like even in the UK and Ireland, for example, these two countries, two of the highest countries with the highest rates of asthma in the world. And I've been seeing and reproducing results to it. I would expect a 50% reduction of symptoms in 2 weeks from people who genuinely put the exercise into practice. 20 clinical trials on the Buteiko method for asthma. And yet, the vast majority of people with asthma and children go into their doctor's surgery. Many of them will be mouth breathing. The doctor gives them medication. There's no attention paid to how they are breathing. And these children and adults will continue to have symptoms because of a poor breathing pattern that's feeding into their condition.